Hello everyone, welcome to my channel. So today let's learn about postpartum hemorrhage. Okay, so let's start with the definition. Postpartum hemorrhage is defined as a excessive bleeding following childbirth. So how much bleeding is PPH? Because during delivery, be it vaginal or be it cesarean, there is a blood loss, right? So if in vaginal delivery, more than or equal to 500 ml is called PPH. And if it is cesarean section, more than 1000 milliliter or equal to 1000 milliliter, then it is called postpartum hemorrhage. When you're writing in your exams, make sure that you write these two numbers, like on how much blood loss during vaginal delivery and how much during a cesarean section is called PPH. Okay, so there are two types of PPH, primary PPH and secondary PPH. What is primary PPH? Bleeding that occurs within 24 hours of delivery. Okay, and mostly you'll see this bleeding happening within 2 hours of delivery. Okay, so this is the reason as to why we keep the mother for in an observation for 2 hours observation soon after the delivery. And I'm sure right now you must have been posted in the labor room and you are witnessing this. Okay, so what is the cause of primary PPH? Tone, trauma, tissue and thrombin. There are 4 T's. Tone means the uterus tone. Soon after the delivery, the uterus actually should contract and should become hard. But then here the uterus is what is the uterus? The uterus is flappy. So the tone of the uterus is not um, the uterus has not contracted, so that is the reason why bleeding is happening. Okay, and then you have a trauma. Trauma is like any trauma or a tear in a tissue in a cervix, vagina or perineum. So this is leading to bleeding. You need to check that also. Tissue, any retained placenta. Okay, if a placenta has any bits of placenta being retained in the uterus, that also can cause primary PPH. And then you have a thrombin, that is a coagulation disorder, meaning that the blood does not clot properly. Okay, now coming to secondary PPH. Secondary PPH means delayed or late postpartum hemorrhage, which usually occurs after 24 hours of delivery. Okay, and mother usually complain of delivery within between 8 to 14 days of delivery. Okay, and what is the cause of primary PPH? Retained placenta, sepsis, and wound that is caused by cesarean section. Okay, and estrogen therapy. And estrogen therapy usually, if a mother is in estrogen therapy, there is something called withdrawal bleeding that happens. Okay, so these are the two types of PPH. Coming to clinical manifestation, you'll see vaginal bleeding, obviously. And then when do you call it is PPH? It is if a mother saturate one pad within 5 minutes. Okay, and then you'll see a large clot also. At the same time, we also see mother being pallor, and then tachycardia and hypotension also you will find. And then after that, flappy uterus, decreased urine output, sign of shock is 2T, 2H. Okay, tachycardia, tachypnea, hypotension, hypothermia, and you'll also see unconsciousness. Okay, so pathophysiology. If the uterus fails to contract or if bleeding is happening due to trauma, okay, what happens? The bleeding occurs due to open in the uterine blood vessels. Because of that, the body tries to compensate with increase in heart rate. With that, what also happens is there is a peripheral vasoconstriction so that the blood flows to the heart. Okay, and there is also a mobilization of blood from the liver and spleen to the heart. Okay, after that, even after that, the bleeding still continues and the mother is left unattended. What happens? There is a hypovolemic shock. Organs begins to fail due to lack of oxygen. Okay, and then what happens after if it still continues, then there is a clotting, there is a depletion of clotting factor leading to DIC, that is disseminated intravascular coagulation. Okay, and after that what happens, there is a metabolic acidosis, there is a complete organ failure, and then death. Okay. Okay, so let's learn about risk factor. Women who are at the risk of having PPH. Okay, so one is anemia, two is postpartum, sorry, pregnancy-induced hypertension. It can also be due to over distension of the uterus, that that is because of multiple pregnancy or polyhydramnios. Okay, and then infection, antepartum hemorrhage, prolonged labor that stretch for more than 24 hours, and precipitating labor, that is a very rapid labor and delivery is called precipitating labor, and multi-grand multipara, that is the mother who has a more than 4 children. Okay, so now let's learn about management, very important. So once you get to know that the mother is bleeding, first thing what you need to do is call for help. After that, rule out the bleeding. What is the cause of the bleeding? Maybe because the uterus is flappy, that is why it is bleeding. Maybe because of trauma, maybe because of retained placenta. Okay, so your another staff or your another colleague, what she should do is IV line. She should connect the IV line in both hands. Okay, and start oxytocin 20 units in 1 liter at the rate of 40 drops per minute. Okay, and then she should also collect blood sample for cross matching. And after that, another staff, what she should do is catheterize the bladder. So here what we are doing, three things: IV, starting oxytocin 20 units, we are collecting blood sample, and then we are catheterizing the bladder. Okay, so let's learn about the specific management of atonic PPH. If atonic PPH happens, so first you need to do a uterine massage. At the same time, we can also do bimanual uterine compression. Bimanual uterine compression is this one, the picture one. So what you need to do is that you need to make a fist, and then you need to press the uterus. Okay, and with another hand, what you need to do, from above the abdomen, you need to press the uterus so that the bleeding stops. Okay, and one thing, remember, this is a temporary, but at the same time, along with the bimanual compression, you need to give even a uterotonic drugs, that are oxytocin, methergine, carboprost, misoprost. Okay, misoprostol. So these are the drugs that you can use for the to stop the bleeding. And at the same time, also you can do aortic compression and condom, and use condom tamponade. Okay, so what is so this is the aortic compression. What you need to do in aortic compression, you need to make a fist. Okay, and keep your fist over the umbilicus, slightly left side of the umbilicus, and then compress and press downward, and this aorta should come between the spinal cord and your fist. It should compress between your fist and the spine. Okay, so that is when the bleeding stops. Okay, and the other way of controlling the bleeding is condom tamponade. The condom tamponade, in here we insert a condom inside the uterus, and then fill the uterus with the fluid, which is NS, and then we can keep this condom tamponade inside the uterus for more than 24 hours. Okay, thank you. If you find it helpful, then please do share with your friends, and do not forget to like and subscribe. Until then, see you in my next video.